Welcome everyone, Dr. Naveen here from Med Campus. In this short video, we'll quickly discuss the differences between a direct inguinal hernia and an indirect inguinal hernia. So most of the times we tend to confuse what is medial and what is lateral. So there is a mnemonic for it, that is DMs don't lie. Okay, or DMs never lie. So what does it mnemonic indicates? Direct inguinal hernia is medial. Okay, direct inguinal hernia is medial. Indirect inguinal hernia is lateral. Okay, so when I talk about medial or direct inguinal hernia, it is because of the weakness of the abdominal vessels and there is protrusion of the abdominal contents through the medial abdominal wall through the Hasselbalch's triangle. Coming back to indirect or lateral inguinal hernia, this is more or less seen in young men, and this is because of the patent processus vaginalis, and it is present lateral to the inferior epigastric arteries because it is starting from the deep inguinal ring and from there it is traveling to the superficial inguinal ring. It even reaches to the base of the scrotum. That's why it is more or less globular or pyriform in shape. Whereas direct inguinal hernia comes directly from the middle of the abdominal cavity. Okay, it is rounded in shape, more or less globular or rounded in shape, and it does not usually reach till the base of the scrotum. As I said, because it's a medial hernia, it is present medial to the inferior epigastric vessel. So these are the basic differences anatomical wise. There is one more area I had seen a lot of MCQs coming up in competitive exams is the coverings of these. If you talk about direct inguinal hernia, it has to travel directly, like there is no link to the inguinal canal as such. So that's why it is actually covered by the abdominal muscle layers, right? So hernia contains a peritoneal cavity. On top of the peritoneal cavity, you will see fascia transversalis, then comes conjoint tendon, then comes external spermatic fascia and skin. So you will see predominantly abdominal wall coverings. Whereas indirect or lateral inguinal hernia comes through the inguinal canal. So inside the inguinal canal, there is spermatic cord also. So it will also have spermatic cord coverings. So when there is a swelling in the inguinal canal, so it is covered by, yes, you will definitely see a peritoneal covering, then internal spermatic fascia, cremasteric fascia, then the usual external spermatic fascia and skin. So these are the coverings. Apart from that, there are different tests that we do. One test is Siemens three-finger test. Okay, when you do a Siemens three-finger cough impulse test, if cough impulse is felt on index finger, it is indirect hernia, II. If it is felt on the middle finger, it is direct hernia. If it is felt on the ring finger, it is femoral hernia. When we do an invagination test, okay, the indirect hernia will be felt on the tip, whereas direct hernia will be felt on the pulp. Apart from that, there is a clinical touch to it, right? If you want to treat, you must treat